ever experienced numbness or tingling in your hand or fingers? It's more common than you think. Imagine this. You're going about your day, typing away at your computer, or maybe doing some heavy lifting, and suddenly you feel a strange sensation in your hand. It's a bit like pins and needles, but it doesn't go away when you shake your hand or take a break. It's persistent and maybe even a bit uncomfortable. Now, you might shrug this off as just one of those things. Maybe you've slept on it funny, or perhaps you've been using it a bit too much. But what if I told you that this could be a symptom of something more, something that affects millions of people worldwide and could potentially lead to more serious issues if left unchecked? If you've ever experienced these symptoms, you might want to stick around and find out why. This discomfort you've been feeling, it could be something called carpal tunnel syndrome. To break it down in simple terms, carpal tunnel syndrome, or CTS, is a condition that affects the hand and wrist. Imagine a narrow passageway on the palm side of your wrist, a tunnel if you will. This is the carpal tunnel. It's small, but it's got a huge job to do. It protects a main nerve to your hand, the median nerve, along with the 9 tendons that allow your fingers to move. Now imagine if that tunnel somehow became smaller, or the tissues surrounding those tendons swelled. This would put pressure on the median nerve. And that, my friends, is the root cause of carpal tunnel syndrome. It's like squeezing a water hose. The flow is compromised, and so is the function. The median nerve, which runs through this tunnel from your forearm into your hand, is responsible for sensation in the palm side of your thumb, index, middle, and part of the ring fingers. It also sends signals to move the muscles around the base of your thumb. So as you can imagine, any pressure on it can have quite the impact. What kind of impact, you ask? Well, the symptoms of carpal tunnel syndrome can include numbness, tingling, and weakness in your hand. These sensations often develop gradually and start off being more noticeable at night. You might feel like you need to shake out your hand to relieve the symptoms. As the condition progresses, you might feel these sensations during the day as well, especially with certain activities like holding a steering wheel, reading a book, or using your phone. In some cases, you may also experience discomfort in your wrist and the palm of your hand, or even an ache running up your arm. It's like a ripple effect caused by the disturbance at the source, the compressed median nerve. So that tingling in your fingers, it might not be as simple as you thought. But how does one get carpal tunnel syndrome, and can it be prevented? Carpal tunnel syndrome, often abbreviated as CTS, is typically caused by a combination of factors. The most common culprits are repetitive hand movements, like typing or assembly line work, which can strain the wrist over time. Wrist injuries or conditions such as arthritis can also lead to CTS, as they may cause swelling in the carpal tunnel. Certain health conditions, such as diabetes or hormonal changes during pregnancy, can increase your risk as well. Though we can't always avoid these risk factors, we can certainly take steps to prevent CTS. Frequent breaks from repetitive tasks can reduce strain on your wrists. Simple stretching and strengthening exercises can also help keep your hands and wrists healthy. Additionally, maintaining proper form and posture, especially while performing repetitive tasks, can significantly decrease your risk. Remember, prevention is always better than cure. But what if you already have carpal tunnel syndrome? Is there a way out? Indeed, there is. Common treatments for carpal tunnel syndrome or CTS include splinting, which helps keep the wrist in a neutral position, especially during sleep, to alleviate pressure on the median nerve. Then there's medication. Non-steroidal anti-inflammatory drugs, or NSAIDs, can help reduce inflammation and pain. Steroid injections can also provide temporary relief. In severe cases, surgery might be the way to go. Known as carpal tunnel release, this procedure relieves pressure on the median nerve by cutting the ligament pressing on it. However, remember, everyone's different, and what works for one may not work for another. So, if you're experiencing persistent symptoms, it's paramount to seek medical advice. Don't let carpal tunnel syndrome keep you from living your life to the fullest. Seek help if you need it, and remember, knowledge is power. So if you found this video helpful, don't forget to subscribe and hit the bell for more content like this.